Healthcare Leadership Council. We're a trade association in Washington, D.C., comprised of chief executive officers of many of America's leading healthcare companies, representing all sectors of healthcare. So we have hospitals, health plans, pharmaceutical, medical device manufacturers, just to name a few, but it's a very diverse group advocating for high quality, cost-effective care.
What are we doing here today?
Well, today we're going to recognize a wonderful program here in Louisiana that focuses on wellness and prevention called Well Ahead. We're going throughout the country trying to shine a spotlight on programs that are working at the local level and see if we can disseminate them more broadly. But they're just doing a great job in helping people develop healthy habits and making a big difference.
So this program is the most important in Louisiana because it's Louisiana is 49th on health. We need this program more than any other state. So the way that we eat, the way that we live, our behaviors have more to do with our health than the medicines we take and the doctors we see. Behavior is a really important component of health. And today we're here to recognize programs that help us have healthier behaviors. Behaviors like exercise, eating well. Those are the kinds of things that help keep us healthy every day and out of the doctor's office.
Businesses across the state have really responded well to Well Ahead Louisiana. I don't think it's a secret anymore that chronic disease definitely contributes to not just personal health care costs, but also larger financial health care costs for businesses. And so worksite wellness and employee initiatives to really improve the health of the workforce has certainly gained momentum across our state, and we really believe that Well Ahead Louisiana is supporting businesses in that process. Well Ahead Louisiana is an initiative of the Louisiana Department of Health, fostering a community-based network, promoting healthy spaces and places across our state, connecting Louisiana organizations and residents to a healthy future. Our team is supported by the Centers for Disease Control and Prevention's Division of Chronic Disease Prevention and Health Promotion to work across Louisiana, helping people and communities prevent chronic disease and promote health and wellness for all. Our areas of work include heart disease and stroke risk reduction, tobacco cessation and prevention, oral health promotion, and obesity and diabetes prevention. Our mission is to connect Louisiana communities to a healthy future. As part of the Well Ahead Louisiana initiative, we developed the WellSpot designation program. This program is our way to impact and interact with local communities, teaching them about healthy changes they can make to better the lives of those they influence directly. With our partners, we created a set of wellness benchmarks for 7 different types of organizations: work sites, child care centers, schools, colleges and universities, restaurants, hospitals, and healthcare facilities. These place-based benchmarks, combined with community outreach, encourage policy, systems, and environmental change surrounding health behaviors and can be implemented for little or no cost at all. Once an organization has reached a certain number of benchmarks, the Louisiana Department of Health designates them as a level 1, 2, or 3 WellSpot. To become a WellSpot, organizations visit our website at wellaheadla.com and take a pre- and post online assessment. These assessments provide the information used to measure the health impact by implementing the benchmarks across our state. As more spaces and places in our communities become WellSpots, our residents are given the opportunity for a healthy future.
The name of the company is Calls Plus because we started out taking telephone calls like an answering service and then became a full-fledged contact center. We work for government agencies in 36 states. And we were actually visited by one of the WellSpot people. And of course we were anxious to talk with them because I need some help in convincing people to be healthy all the time, around the clock. You know, we're 24/7. We work 24 hours a day in our shop. I was very, very anxious to implement this program in our community, in our call center. The whole initiative, knowing that this was part of a community, not only Calls Plus, but the greater Lafayette community, was really inspired by the Well Ahead program. In order to become a level 2 spot, we had to meet some benchmarks. We had to cut out smoking. We had to embrace healthy food. And the hardest thing of all was to get everybody to agree to our STEP program so we could actually count the steps, count the miles we walk every day, we swim, we bicycle. And there was a lot of enthusiasm about that, actually.
I worked for the company for 17 years. Before the wellness program, we spent a lot of time sitting in our chairs, eating unhealthy snacks, just basically living an unhealthy sedentary lifestyle. Since the wellness program, we've all been walking more. Each one of us has to do a minimum of 3,000 steps, and we're challenging each other to do better, to be more active, and it's just been great because we're all cheering each other on, and we feel accountable to one another to make sure we're making the healthy changes we need. Before our wellness program, we were all like our little own island, and now that we've started the wellness program, we feel like a true team. We're talking about the changes that we're making. We're forcing each other to get out of our seats. We have walking buddies. We have classmates who come to different activities with one another. So we not only get to spend more time with each other and learn about each other, but we're making healthy changes together.
And when I first started, it was 8 hours of just sitting still at a computer typing. Now you're getting up, you're moving around, you're going for walks and things like that. So it's keeping us moving, getting us in shape.
It's interesting, a lot of our workforce are women, and women who have children. And they know what they want for their children. They don't want their children to grow up and be obese. They need exercise, they play basketball, baseball. No, they're not ready to do that themselves, all of them. They feel that by encouraging their children to be like them and to embrace a healthy lifestyle, I think that's the most important thing. And you knew that you were going to be active, healthy in the workforce for another 100 years. What would you do differently today? And the one answer is, I take care of my health. Wellness.
Town of Arvita Springs is a Choctaw Indian village that became a tourist area turn of the century when so many people were coming out of New Orleans with yellow fever. We had a number of benchmark areas that we'd be in. It had to do around healthy eating and exercises. And one of the things is we had spots where we would take time off to become exercise and also to measure our steps and also our number of weight loss, how much weight we lost and how many steps we took every day. But once I began to see the weight loss and the energy of my staff, administration, I saw the benefits of it. Healthy eating gave them much better attitudes. It also made us a better team, and that was the important thing. Our administrative team became much more effective because of the healthy lifestyles we had been doing. They gave us a bunch of things to do, to be honest with you. They gave us some exercise routines, they gave us some healthy eating routines, they gave us links to our farmers market. We have a farmers market in Abita, and they gave us some healthy eating choices based on the fresh fruits and vegetables that are grown locally. We created a culture of wellness by assigning a wellness guru. She then got everybody else to buy in on this. And we then began to show the benefits. We have great attitudes. They have great customer relationships. Everybody feels better, seems to be happier, and very much more productive. We're a service company. You know, we are a service organization. That's what small towns are. Everybody that comes in that office is expecting to be serviced. We provide better, quicker, more friendlier service. Well, it means a lot. It means that hopefully people will understand if Abita Springs can do it, a little small community like we are, then it can be done in any community that's out there. I would ask you to listen to the representative from the Well Ahead organization. Now, again, when they first came in, I wasn't a big fan of it. They showed me a whole bunch of things, so you got to listen to what they say and put it in place.
Thank you, and thank you again, Well Ahead Louisiana, for helping Calls Plus move our employees forward to a long and very healthy life.
I'd like to give a very big thank you from all my staff and from the town of Abita Springs to Well Ahead Louisiana for teaching us how to be healthy.
Well Ahead Louisiana is honored to accept the prestigious Wellness Frontiers Award from the Healthcare Leadership Council. Receiving this national award commends our state's efforts to balance Louisiana's vibrant culture with healthy living. It also celebrates our residents, community leaders, and our partners who take an active role in preventing chronic diseases. Thank you for helping us move Louisiana's health forward.
I'm John Finan. I have the privilege of serving as the President and Chief Executive Officer of the Franciscan Missionaries of Our Lady Health System. And we're delighted to have you on our campus this afternoon. On this day following the eclipse, we're reminded of St. Francis's Canticle of the Sun, in which he praises God for some of the wonders of the world. And Francis referred to elements of nature as brother this or sister that. Francis believed that everything in the natural world was a gift from God, and as such deserved to be appreciated and valued. Having experienced the wonder of the solar eclipse yesterday, let us remember God's presence in everything around us. So I'd like to begin with a prayer. As we remember that we're always in God's presence, Almighty God, guide us in the work we do, that we may do it not for self alone, but for the common good. Make us mindful of the rightful aspiration of others, and arouse our concern for those most in need. Anoint us to do your will. All this we ask in your name. Amen. So on behalf of our sisters and our entire team, I'd like to welcome several distinguished guests who are part of today's program. Senator Bill Cassidy has joined us. Welcome. Congressman Garrett Graves is here now. Thank you, Garrett. Glad to have you with us. The Department of Health Secretary Rebecca Gee is here, and Mary Greeley, the Executive Director of the Healthcare Leadership Council in Washington, D.C., of which we are, I think, the only Louisiana member of that organization. I'd also like to recognize the many outstanding partners who are joining us today from around the state. Thank you all for being here and for your commitment to improving health care for all Louisianians. And welcome to our conference center. Each day, our physicians and team members focus on delivering exceptional experiences and high-value care to our patients and communities throughout the state. Like St. Francis's passion for God's creation, we're deeply passionate about improving lives in Louisiana. So on behalf of my 14,000 colleagues with whom I share this ministry, we're privileged to serve approximately half of the families in Louisiana through our hospitals, physician clinics, ambulatory centers, senior housing, health and wellness programs, and much, much more. And as I look around this room, I know we're not alone. Healthcare impact is a passion we all share. Thank you to Senator Cassidy and Congressman Graves for your leadership at the federal level, and to Secretary Gee for your innovation and commitment that's transforming our state's health status with ever-improving success, results, and partnerships. Bringing more care to more families, you recognize that Louisiana deserves our best. Our kindred passion and purpose is what brings us here today. So without further ado, I'd like to turn the podium over to someone whose dedication to improving health and wellness in our state truly shines, Secretary Rebecca Gee. Please join me in welcoming the Secretary. Thank you.
Good afternoon, everyone. Thank you to Senator Cassidy and Congressman Graves for joining us today and for recognizing the achievements of members of my department, the Louisiana Department of Health, in helping to improve a state that is the best in culture, the best in food, but the worst on health in our nation. So thanks to Melissa Martin, so proud of you and our Well Ahead team. And thanks to Dr. Raynaud and Dr. Foch and our new head of our Office of Public Health, Dr. Jabari, your efforts in communities in our 64 health units throughout the state to both educate the public, to respond in times of disaster, to help when there's a Zika fear, to educate people about safe drinking water, safe environments, and healthy behaviors has made a big impact on this state. And the fact that we're getting this a national award is a tremendous opportunity for us. So really, Melissa, this is your award today. Really, really proud of you and our team. And you are a dogged in terms of your persistence about healthy behaviors. And frankly, healthy behaviors are more important. I'm a practicing physician. Continue to see patients. Saw one 2 weeks ago who's lost 20 pounds since I last saw her. Very proud of her. And probably that behavior, the behaviors that led to her losing weight, are more important than what I did during my office visit. It's what we do in our behaviors every day. It's how we eat, how we work, where we live, our diets, whether we smoke or not. They're probably more important to health than health care. And of course, I have a budget that's focused on health care delivery. And I wanted to recognize, as John Finan said, the Franciscan Missionaries of Our Lady have had a tremendous impact on the delivery of health care of our state, and I would be remiss not to recognize them today in this beautiful facility. They touch the lives of almost half of the people of our state and the most vulnerable individuals in our state. So thank you, John, and to the sisters for having us today. But the health care that we provide and the health care that we pay for can only go so far. It's our behaviors that really help make us healthier. And so that's the Well Ahead program. And it's said that a journey of 1,000 miles begins with one step. I want to recognize today the Franciscan Missionaries of Our Lady who have taken 110 steps with well spots throughout the state in your various facilities, and our Well Ahead program that has now touched the lives of well spots of individuals who access those well spots in more than 2,000 spots throughout the state. So your efforts are making a big impact. I'm very, very proud of you for this national award. This is your day.
I'm going to wear 2 hats, maybe 3 hats, maybe 5 hats. But as many of you know, I worked at Earl K. Long Hospital for 25 years, trying to bring healthcare, good healthcare to folks who otherwise would not have. And now I'm the U.S. Senator, so I wear kind of the hat of the provider and the hat of the folk trying to do public policy in a way which makes our state and our country better off. There is a common theme. If you give the patient the power, the patient is better off. It may be through what you do. It may be through giving her more choices on insurance. It may be price transparency, you name it. But giving the patient the power is what drives change. I love your program because it empowers patients. It gives them the tools for empowering patients. And by the way, it's not just my opinion. About 10 years ago, McKinsey wrote a report saying that the only way we decrease the cost of health care is if we lower administrative overhead, price transparency, and take care of the burden of chronic disease. The burden of chronic disease. And what is the burden of chronic disease? In our state, principally related to obesity. From that, you get hypertension, diabetes, renal failure, heart failure, joint replacements, and many other things. You are empowering patients to not only decrease their own personal cost of health care, but frankly, our community and our nation's cost of health care. You're also empowering patients to feel better. I loved it. I won't try and do the Zumba as the women were doing the Zumba. But they had smiles on their faces. Now, I don't think they were embarrassed. I think that they were just enjoying themselves. There's a nurse I worked with at Earl K. Long, Eddie. Eddie probably weighed 250 pounds. And he decided to be empowered and just directionally begin to walk the LSU lakes. It doesn't matter what the weather is. Eddie is walking. And he's not just strolling as my wife and I do, pushing our grandchild. He is working it. And he gets other people to come along with him. And so not only has Eddie become much healthier, losing so much weight, he's become an evangelist in which he says, hey, listen, come walk with me. You can also feel good. Because we know that we're in better shape, we tend to feel better. And that's from empowering patients. And lastly, I'll point out from your slide, but also from my physician experience, but also from our common life experience. You empower people not by saying, go forth and be empowered. You empower them by giving the tools to become empowered. Oh, by the way, we're going to be having a healthy selection, not just cookies shaped like apples, but perhaps apples shaped like cookies. So our lunch line will now have healthy choices. Oh, we're going to take a 30-minute break where in shifts we can go do Zumba. And we're going to change our dress code so that you can actually wear clothes in which you can Zumba. I kind of like that word, Zumba. It may be that you put a shower so that somebody can bike ride to work, so that when they get there, they can shower. All these things, a little bit of an initial upfront, but a long-term payoff as your patients are healthier, your employees are happier. And last I want to finish with, when you empower folks, particularly women, it tends to become generational empowerment. I loved what Miss Lamont said. She said they're going home and they're getting their kids engaged. Now that's wonderful. There was a New England Journal of Medicine article a few years ago, which pointed out that life expectancy for children is now shorter than it used to be. And they related that to the obesity epidemic affecting children. And diseases that used to only start to have an onset when you're middle age or older, because that tends to be when we get heavier, we're now having their onset at a younger age because the children were heavier at a younger age. The empowerment of those moms to go home and speak to their children, to get them engaged in the sort of lifestyle that will stay with them for the rest of their life, pays dividends upon generation and upon generation. So thank you for what you do. I truly think you'll have crowns in heaven, not just for the empowerment you've done for folks now, but also for the empowerment you've done for the future, not just for the benefits of that empowerment for our community and for our state, but also for our country. And I say that as a fellow who is a public policy person, who is a doctor, but most of all is a fellow American. Thank you very much.
Hey, good afternoon, everybody. I'm John O'Donnell. I'm the Well Ahead representative in Region 5, which is Southwest Louisiana, and I'm also the coalition coordinator of Healthier Southwest Louisiana in Region 5. And I'm going to talk to you a little bit today about how Well Ahead is working to make Louisiana a healthier place to live, not just by implementing these worksite wellness policies and getting people up and moving and eating better, but also by helping to create coalitions like mine, create partnerships that help drive communities forward together. Healthier Southwest Louisiana was established in 2011 with the leadership of Dr. B.J. Foch, our regional medical director in Region 5. And our mission is to get people to move more, eat better, and stop using tobacco. Since the coalition was started in 2011, we've grown to over 170 businesses, organizations, governmental entities and agencies, and individuals. And one of the ways that we're working to fight chronic disease and accomplish this Healthier Southwest Louisiana is by working with Well Ahead. In addition to making communities healthier through the program itself, Well Ahead's opening the doors to creating coalition partnerships and helping us start events and cool things that we wouldn't have had they not opened those doors. One of my favorite partnerships that Well Ahead's helped to create was with a Native American tribe. The tribe contacted me and they were interested in Well Ahead because they saw a high instance of smoking and diabetes in their community, which is common among Native populations. During my first visit to the tribe to discuss Well Ahead, I made a Native American linguistics expert there at the reservation who talked to me a little bit about the struggles of retaining and preserving the tribe's dying language and culture. Through our discussion, we realized that many of the struggles they faced when it came to cultural retention were similar to the struggles they faced in preventative health. And that the traditional culture of the tribe was actually included a very healthy lifestyle. We started working to find ways that we could combine public health and preventative health with cultural and linguistic retention. So we learned about traditional Native American diets, cooking habits, games, dancing, and then we put all those things to work. So while working with the Tribal Council to designate all the reservation facilities as well spots, we started hosting a traditional cooking class, where we highlighted and demonstrated recipes that included traditional foods and cooking methods. We hosted dance classes that combined the fitness-like atmosphere of Zumba with traditional dance. And finally, we began working on a large event where all of these things could be combined. So we hosted a wildly successful Couch to 5K program with the Tribal Council itself and the tribe. And it culminated in a 5K run on the reservation that was open to anybody that wanted to attend. The event itself was centered around the fitness event of the 5K, but it was actually a day-long event where we featured traditional foods, crafts, dancing, and we took the atmosphere and theme of fitness and applied it to a festival of Native traditions, effectively making fitness and health one of those traditions. Without these WellSpot's initial interest in Well Ahead, none of these conversations would have happened, and we wouldn't be doing some of the amazing coalition work we're doing today in Southwest Louisiana. So now I think I'm going to turn it over to Ms. Katrin Alb.
Good afternoon. My name is Katrin Alb, and I'm the Breastfeeding Initiatives Program Coordinator at Tulane University's Mary Amelia Women's Center. I'm also a member of the Louisiana Breastfeeding Coalition. In partnership with the Louisiana Department of Health's Bureau of Family Health, the Mary Amelia Center and the Louisiana Breastfeeding Coalition implement a program that recognizes employers in Louisiana as breastfeeding-friendly workplaces for their efforts in providing lactation accommodations for all of their employees. Breastfeeding allows infants access to the same quality of nutrition and immune protection regardless of social and economic resources. It's pretty amazing. As breastfeeding duration is related to many short and long-term maternal and child health outcomes, it has implications for reducing health disparities throughout the life course. Most women go back to work after 6 to 12 weeks after they give birth, but it's recommended that babies breastfeed or are given breast milk for at least 6 months and up to a year, continued for a year and beyond. Therefore, workplace support programs are really essential to help moms continue to breastfeed or pump breast milk for their babies after they return to work. National research shows that 2 out of 3 mothers who intend to exclusively breastfeed don't actually meet their goals because they have a lack of support, whether that's at home, at work, or in the community. Employers who do provide accommodations for breastfeeding employees usually find that it's good for their business. Employees who breastfeed instead of formula feed, both moms and dads, usually have lower healthcare costs, lower absenteeism rates, and higher employee productivity. But sadly, many employers don't know this information, and they need help putting accommodations into place. Well Ahead has helped us meet this need for raising awareness among workplaces. Well Ahead has partnered with us by incorporating breastfeeding benchmarks into many, if not all, of their WellSpot criteria. Their staff have played an enormous, we're really thankful, role in assisting workplaces throughout Louisiana in becoming breastfeeding-friendly workplaces. Our data shows that 80% of organizations who receive the breastfeeding-friendly workplace designation do so as a direct result of Well Ahead outreach. And we are really thankful for this fruitful partnership. I am now going to turn it over to Colette Barrett, who is with Our Lady of the Lake Regional Medical Center.
Good afternoon and welcome to the Franciscan Missionaries of Our Lady Conference Center. I'm Colette Barrett, and I serve as the Vice President of Mission at Our Lady of the Lake Regional Medical Center. It really is a privilege to be here today with so many statewide partners who are working to improve the health and wellness in Louisiana. Especially want to thank you, Senator Cassidy, for your comments, and for Congressman Graves for taking your time today to be here with us. As a mission-driven organization, a provider of health care, we lead by example to promote and recognize healthier choices in the workplace and beyond. Our Lady of the Lake had the honor of being the first hospital in the state of Louisiana recognized as a Level 1 WellSpot back in 2014. And at that time, Our Lady of the Lake College, now the Franciscan Missionaries of Our Lady University, was one of the first institutions of higher learning that was recognized as a Level 3 designation. And I'm proud to say just recently that we re-achieved our designations and are for the first time earning designations for Our Lady of the Lake Children's Hospital. It's coming up out the ground. You can see it on the interstate. And our physician groups. So this is a significant achievement because it designates both adult and pediatric clinics and programs from Baton Rouge to Lafayette to Monroe and the North Shore. In all, as Dr. Gee stated, we have a total of 110 well spots. I've heard this might be the most of any single organization since the Wellhead program began. I'm just saying. We've embraced a culture of wellness inside our own organization. We also reach out to the families of our team members, as well as the children in our public schools through our health centers and schools programs. This, as well as the community around us. We support many initiatives that provide and promote healthy lifestyle choices. Everything from the meal options that we have in our cafe to healthy vending and campus-wide walking paths. Our Healthy Lives corporate wellness program is an award-winning best practice model. Our Farm to Work program provides team members and community partners with direct access to fresh fruits and vegetables. And let's not forget our continued corporate support for the nationally recognized work of Healthy BR. All of our campuses are smoke-free. We were partners in the recent passage of Smoke-Free BR by the East Baton Rouge Parish Metro Council, and we applaud their decision to extend the smoking ban to casinos and bars. Kids across our community know our 5210 plus 10 obesity childhood prevention message, which is a very important aspect of our pediatric wellness program. We are honored to be a designated WellSpot, but more importantly, we recognize the commitment to health and wellness it reflects and promotes among individuals, groups, as well as businesses. We're always pleased to share our learning and experiences with others to replicate in their own organizations, thus helping you all and us build a healthier Louisiana. We are grateful to the Department of Health for their leadership in driving healthier lifestyles in our state through the Well Ahead program, and to all of our partners here today who share our vision for a better, healthier Louisiana. Now I'd like to turn this over to Chief Chris Kaufman, the St. Tammany Parish Fire Protection District 1. Thank you.
Thank you. Good afternoon. My name is Chris Kaufman. I'm the Fire Chief of St. Tammany Fire Protection District Number 1. I'd like to take a moment to recognize two of my colleagues, Cheryl Gross and Chad Dufo. Would y'all stand, please? The reason why I want to introduce those two individuals because we wouldn't be a level 1 without them. It takes leadership. It takes empowerment. Senator Cassidy mentioned that so many times. And we have a great team at District 1 that allowed us to achieve that. We have 166 employees protecting over 90,000 people in a parish of 250,000. We were designated a level 1 well spot in September of 2015. The well spot designation program has changed our organization in a very positive way. It's also been well received in our community. One of the biggest changes we made was to create a culture of wellness, was becoming a tobacco-free workplace. It was important to us to become tobacco-free because cancer is one of the leading causes of death in the fire service. We promoted healthier eating in our workplace by bringing a nutritionist into our department to teach our employees how to prepare healthier meal options because firemen cook 3 meals a day on their 24-hour shift. For over 10 years, we've had a fitness program allowing 1 hour a day to go to the gym or by doing a CrossFit program at the station or in some cases just walking. By providing a healthy environment with positive results, it reduces the stress in our environment. We're an agency that's progressive and we'd like to be proactive, not reactive. We are the only internationally accredited fire department in the state of Louisiana in one of 230 worldwide. The Well Ahead initiative fit right into our organization. We strive to become an above average fire department in Louisiana. Well Ahead changes someone's life for the better. With it, I hope we give our employees the opportunity to live long and spend time with their families after their commitment to public service and for so many years. We would like them to live to enjoy their retirement. Our employees are are our greatest investment, and we want our employees to know how much we value their service. One of the benefits we've seen from being a WellSpot is that we've seen a small decrease in sick leave. We've seen an increase in personnel who have embraced the fitness program and a healthier diet that helped them lose weight. It's been contagious in a very positive way. In the past 3 years, we've had a 10% reduction in healthcare costs. I just signed a 4th-year renewal at a 2.9% increase. So no question about it, we think the Well Ahead initiative has helped us do that. We cost avoided over $2 million over the past 10 years in healthcare premium. We are a group with our dependents of almost 500. I would say that's an achievement in Louisiana when the national trend is 11% increase annually in healthcare. The Well Ahead initiative is a contributing factor to help us become a more efficient organization. And by efficiency, I mean what we're delivering. If I have a healthier employee that can work harder, that's more productive, and that serves the community in full capacity every time someone calls 911, in our book, we've done our job as public servants. When you give your employees a positive message that they are valued, I don't think you can put a price tag on that. I would like to thank the Louisiana Department of Health and Hospitals for helping our organization by creating a healthier environment for our employees and their future. I would encourage everyone to become a WellSpot in the Well Ahead program. Thank you, and God bless everyone.
I have had the pleasure of serving as Executive Director of East St. Tammany Rainbow Child Care Center, a United Way partner agency, for over 6 years. We are the only nonprofit child care center serving low-income families and families in crisis in St. Tammany Parish with a 4-star rated quality child care program. And we are so excited to be the first designated Level 1 child care center WellSpot in St. Tammany Parish. Like some organizations, thank you. Like some organizations looking for creative opportunities to boost employee morale and creative ways to build a vibrant, healthy work environment, I first set a list of priorities. Unfortunately, work happens, and more often than not, my worksite wellness program was constantly being pushed down the list for many reasons: funding, time, personnel, just to name a few. All of that changed in one conversation with Miss Taffy Morrison. Yes, Taffy deserves. And an introduction to Well Ahead Louisiana. Rainbow's staff is comprised of 15 women. Women who nurture, love, and care for over 175 families each year. Women who spend all of their time and energy caring for the families that we serve, their families at home, and who spend little to no time caring for themselves. I'll be the first person to tell you, as a caregiver, that there comes a point where you just can't pour from an empty cup. I knew the message needed to be, if we take better care of ourselves, we'll be better caregivers for the families we serve and our families at home. The importance of living a healthy lifestyle and modeling that behavior for our kids at the center has such a tremendous impact in preparing their minds and bodies for learning, creating happy, healthy employees, reducing stress, increasing productivity, boosting morale, lowering absenteeism, team building, and decreasing healthcare costs. All of the reasons why we needed to do it were there. We just needed to figure out how. We didn't have a single staff person that could wholly take on the responsibility of implementing the changes. We decided to build a committee made up of staff, parents, various stakeholders, and we also reached out to Slidell Memorial Hospital, and we invited them to be part of our journey. In addition to becoming a breastfeeding-friendly facility and promoting a tobacco-free campus, we recently hosted East St. Tammany Chamber Business After Hours, and we actually partnered with local WellSpot restaurants to provide healthy options to all of our guests for the event. Several months in, I see our staff members encouraging other staff members to make healthy food choices. I see dancing in classrooms instead of teachers sitting in chairs. I see a competitive streak as well. We're halfway through our staff-implemented weight loss challenge, and we're very excited about the contagious feeling of changing a cultural environment that has kind of plagued us for many years now. Our partnership with Slidell Memorial Hospital's community outreach has been phenomenal as well. An outreach nurse provides monthly screenings and workshops on information selected by our staff that's relevant to their own personal needs and experiences. The first step to creating change is always the hardest, and Well Ahead started the conversation and provided the tools necessary for us to be successful. They provided a way for us to connect with our employees in a very meaningful way, to let them know that we care about them and that they have the power to create real, meaningful change in their lives and in all of the lives they touch. They're modeling this behavior for the children that sit in the seats, and they're taking it home to the moms and dads and the families that we serve. I would like to say thanks to Well Ahead Louisiana for helping us to move the health of our employees forward, and congratulations on being this year's recipient of the prestigious Wellness Frontier Award. You have truly made a difference in our lives and empowered us to make a difference in the lives of all of the families that we serve. Thank you so very much.
Louisiana is second worst overall health in the United States. Second worst. We're the sixth worst in physical activity. We're the fourth worst in cancer death. We're the seventh worst, I think, in diabetes, or eighth, and one of the top smoking states in the United States. And we're the most obese. Those aren't statistics that we should be very proud of. Now, to go and to pair with the most obese is the fact that we also are often rated the happiest state in the nation. So we're both obese and happy, which is a good combination. But you know, I sometimes think it's unfair, because if we lived in North Dakota, all of us would be skinny as rails. You know, we have great cooking here, we have great food. It makes it a little harder. But when you start looking at the implications of obesity in some of these health conditions, it really is extraordinary. Statistics like approximately 70% of adults in the United States have some type of chronic disease. That approximately 75% of all the healthcare expenses that we spend annually as a nation are spent treating those adults with those chronic diseases. That since 1970, that the obesity rate in our children has tripled. And that today, a quarter of our children spend 4 hours or more watching video games and TV as opposed to doing physical activity. That's not the right trend. And as we get smarter, more innovative, we get better technology and we learn more, we should be heading in the other direction. And we're not. And so this call to action, this effort today, is critical. It's critical from a longevity perspective. It's critical from a financial perspective. It's critical for our future because of the kids, the trajectory that our children are on. So I think it's fantastic that this is, that the state, that the council, that the mission is all focused on moving forward in a different direction, on giving us the tools that we need to move forward in a different direction, to chart a different trajectory for our state, for our nation, and for our children. So thank you very much.
It is a great privilege to be with all of you today. Senator Cassidy and Congressman Graves, I'm so glad that both of you could be here for this event this afternoon. And I'd like to tell everyone here today that your state has powerful, influential, thoughtful leaders in Washington that are fighting for accessible, affordable, quality health care. At the Healthcare Leadership Council, we appreciate the opportunity to work with both of these dedicated lawmakers. And Secretary Gee, it has been a great pleasure to meet you today And I very much admire the passion, the clear passion that you bring to the mission of making sure that all Louisianians have access to health care. So before we proceed with the award, I'd like to say a word about our host this afternoon, John Finan. Our organization, the Healthcare Leadership Council, is made up of many of the nation's top leaders from all sectors of American healthcare. We have hospitals, health plans, pharmaceutical and medical device manufacturers, health plans, pharmacies, and health information technology providers, just to name a few of our very diverse membership. But within this distinguished group, no one has been a stronger voice for wellness, for healthcare access for the underprivileged, for innovations in population health than John Finan. I was very sad early this year when John told me that he is going to be retiring. But I know that he is leaving quite a legacy here in Baton Rouge, in the state of Louisiana, and really throughout the larger healthcare community. At the Healthcare Leadership Council, we will continue working on the kind of healthcare reforms that Franciscan missionaries under John Finan's leadership has championed for a very long time. And speaking of a healthier population, allow me to say just a few words about what brings us all here today. Our nation has, as you have heard, and I don't think it's an overstatement to say, that we have a chronic disease crisis. Here in Louisiana and throughout the country, far too many people are afflicted with diabetes, with heart disease, pulmonary illnesses, cancer, just to name a few. And each of these cases is not only affecting individuals and their families, but as we've heard today, that they collectively represent a tremendous challenge to our healthcare system. We're spending roughly 85 cents of every healthcare dollar on the treatment of chronic illness. That is an astounding statistic. So when we talk about making healthcare more affordable, about trying to bend the cost curve in healthcare, there is probably nothing we can do that will make more of a difference than stopping the escalation of these life-shortening conditions. What we know with certainty is that the best ideas in this arena are not necessarily coming from the meeting rooms on Capitol Hill or from the offices of Washington regulators, but rather, as we're seeing today, from communities throughout this country. Understanding that so many chronic illnesses are indeed preventable, we have seen exciting innovation in every region of the United States, with organizations, with institutions, and truly committed individuals, many of whom you've heard from today, that are coming up with new ideas of how we can keep people healthier. So at the Healthcare Leadership Council, we felt that there was really a need to spotlight these novel and successful approaches to improve population health. And we believe that these shouldn't be just one-off successes that affect just one state or one local community. Rather, we think that these ideas should be widely disseminated so that they can take root in multiple locales throughout the country. So that is why we created our Wellness Frontier Award as our own effort to sort of play Johnny Appleseed, to see if we can bring success from one venue to another and see if we can have them replicated in many more places. And Well Ahead is certainly, most definitely, the kind of program that we want to shine a spotlight on. I think one of the things that impressed me the most about this initiative is that it recognizes that the fight against chronic disease can't happen on just a single front. What we've heard today is that you need to reach out to people where they live, where they work, where they learn, where they eat, where they spend their leisure time, and where they receive their health care. Well Ahead has done exactly that. And in so doing, they have created a far-flung, multi-tiered network that is addressing a host of challenges from curbing obesity to smoking cessation to prenatal care. So I'm not here only to compliment you and to honor you, but also to take what you have done here and try and spread the word to other states and other communities so that they can create their own versions of Well Ahead. So with that, I want to thank not only you for making such a profound difference in the lives of so many, but more specifically, I'd like to ask Director Melissa Martin to join me up here. I hope I can find the right thing. And Melissa, it is my absolute pleasure to present to you, it's the Healthcare Leadership Council's Wellness Frontier Award for recognizing the great success that you have had here in Louisiana, and we hope we can replicate it nationwide. So thank you so much for everything that you've done.
Thank you.
And all of you.
Thank you, Mary, and I'd sincerely like to thank the Healthcare Leadership Council for selecting Well Ahead Louisiana for this Wellness Frontier Award. This award ceremony has been wonderful to hear from all of our speakers today, and of course, thank you, Mr. Finan and the Franciscan Missionaries for hosting us. I'd also like to thank today's speakers. Thanks to our special guests, Senator Cassidy, Congressman Graves, for the congratulations and inspiring words. Thank you, Dr. Gee and the entire Department of Health for your great leadership and support. To the Louisiana Area Health Education Centers, our true boots on the ground in our communities across the state, and other statewide partners like John and Katrin, without you, the work of Well Ahead Louisiana would be impossible. By working together, we are little by little making healthy living easy and accessible to all Louisiana residents. To community leaders like Chief Kaufman and Dion and the regional OPH medical directors, and of course to WellSpots across the state, congratulations. This award celebrates you for investing in the health of your employees as well as your community. Each WellSpot designation is a small step towards improving our state's health outcomes and reducing both the financial and personal cost of chronic disease. And last but not least, to the Well Ahead Louisiana team, please stand so you can all be recognized. Your commitment to Louisiana residents inspires me daily. Thank you for your passion and your hard work. I am honored to be part of such a wonderful team. Thanks to all of you today for your support and partnering with us to continue to move Louisiana's health forward. Thank you. Well Ahead Louisiana is absolutely honored to receive this award today, and more so, we are just very thankful to be able to share this award with everyone across our state. Louisiana doesn't often get recognized for something positive in the world of chronic disease, so to get this recognition for a positive health improvement and health initiative is really a win for everyone in the state.
What would you say to businesses that may be watching this program that are not participating in Well Ahead Louisiana?
Well, you should be participating. Obviously, getting this national award, we are one of the best programs in the nation to keep your office staff well ahead and healthy. Obviously, having healthy staff means that they come to work. They're more productive when they're at work. So no excuse, employers, get involved in Well Ahead. You'll have less out of work days because your folks will be healthier in the workplace every day.
These programs can work. That we really can take steps to prevent chronic illness, to really manage diabetes better, heart disease, by taking effective steps to get healthier. And we can do it at school, we can do it in our workplace, we can do it at home, we can do it in healthcare centers. So really trying to highlight the great work that's going on here in Louisiana with the Well Ahead program.
Yes, I would recommend that all fire departments get involved in being a well spot with Well Ahead.
Absolutely. Recommend that you seriously take a look at the criteria for becoming a Well spot. As a dedication to a healthcare provider, many of the things that we're asked to do for the community, we should be doing for our own team members as well. And so I believe that to whom much is given, much will be expected. And as healthcare providers in this state, it's up to us to lead that effort for a healthier community. And this is one way that we can show that support.
We've seen lots of positive results. Our staff is really motivated to make positive change. We've adopted a healthy meeting policy, which is really encouraging them to make healthy choices at home and model healthy behaviors and lifestyles for the kids and the families at our center.
Whenever you look at the economic impacts of creating a healthier workplace and getting your workplace to be a healthier place to live and work, businesses jump at it. I mean, they save money by having healthier employees. And so we've had a great response from the business community.
Great results, especially with Well Ahead's help. We have many businesses, hundreds throughout the state, that have become breastfeeding-friendly workplaces.
If people have questions like more information about your program, what should they do?
Well Ahead Louisiana has a fantastic website, wellaheadla.com. We also can be found on Facebook, Instagram, and Twitter. Contact us, reach out in any of those ways, and we'd be more than happy to help any business or other community partner work with us.
They can contact through our website, www.hlc.org, and you can learn more about the program, and also just contacting the Well Ahead program here in Louisiana.